Hey everyone, it's Tim Ria, host of Digital Health Live here at Digital Summer Summit San Francisco. Super awesome last panel, the countdown to launch. And we have the ubiquitous Geoffrey Clapp, CEO of Better. I thought I'd drop that in.
Yeah, I appreciate that. Ubiquitous is good. I think anytime you can use the word to describe me I can't spell, that's got to be good. So that's fantastic.
So I'd like to expand my vocabulary, but what is your background? You're from Apple. You've done a number of different deals.
Yeah, so I came to Silicon Valley, right out of school and went to Apple. And I thought I would be at Apple forever. Like my goal was to work at Apple. 95, 96, yeah. And I was like, this is what I'm going to do for the rest of my life. But Apple wasn't so cool back then. And left Apple and started in digital health. Started a company called Health Hero Network with a really smart guy named Steve Brown. And that was also not something that was like a cool thing at the time. It was like being at Apple in 95 and then let's go do digital healthcare. Not exactly.
It's like this .com thing's blowing up.
Honestly, I think the takeaway from this video should be anything I'm doing, do it in 3 or 4 years afterwards, it'll be totally cool. So, we started this company and ended up, after a very long time, going through the bubble burst and everything else, grew it to the largest remote patient monitoring company in the world and ended up selling that off. It took a couple of years off, working with Rock Health and mentoring and working with startups. It was, yeah, exactly, giving so many people. I mean, I was in my 20s, I didn't know what I was doing. So many people helped me get through Health Hero that I wanted to spend a bunch of time kind of giving back. And so then what I was able to do was, after taking that time off, Mayo, Social Capital, and myself all kind of had some similar ideas. And
who's Social Capital?
So Social Capital is a really leading venture capital fund started by Chamath Palihapitiya, Ted Maidenberg, and Mamoon Hamid. And these guys, when they don't think of 200 million people, they think of billions of people. Right?
Billion is cool.
Billion is cool. Well, Chamath's, a Facebook executive, it was, and he thinks about 1 billion people. And so Mayo was thinking about how do we reach 200 million. And for me, I was like, okay, that's a challenge worth getting back in the game for. Like, once you sell your company, sometimes deciding what your next company should be is really hard. And the three of us coming together and saying, this is a really hard problem to go solve, that was like, let's go do that. And so basically, we met a couple of times and then said, let's start a company together. And that's how it started.
The company is called Better.
Yeah.
Did you get better.com? Is that available?
So actually, it's funny. We got getbetter.com. Yeah. I was really excited to get getbetter.com, and it wasn't horribly priced. We tried to get better.com, but you can imagine there's a lot of people going for that one. And honestly,
it's like Get Better, better.
Yeah, for healthcare in particular, it works as this great double entendre that it works. And so, yeah, so getbetter.com is where we're at.
So how long ago was that seminal, the baby injected in the womb, and where are we at now?
Well, you got to understand it was about a year ago. So we fast tracked that process. That was like we met, we dated, we got married, we went on a honeymoon, we took a bunch of vacations, we met each other's family, and had a baby in like a week. We're like we all liked each other, we all agree on the vision, like we're gonna make this happen. So it was about a year ago. Took about 4 months to get our MVP out the door. Showed that off in New York about 4 months after we all got together. And then it's just been, the pedal has been down.
So describe what the MVP is. Is it an app? What's the...
Yeah, the product, really what we're trying to do is bring Mayo's knowledge and combine that with a personal health assistant. Yeah. The job of a personal health assistant is really to be your concierge to navigate healthcare. So
it's a maze, and it's like, can I get my records, or what's this?
Getting records, making appointments, health insurance issues, all of these like gigantic challenges. And so what we found is that people don't trust the healthcare system. It's not a really big shock. But what we found is they start to trust people who help them solve problems. And they want to know that these people have no perverse incentives. It's something that works for them. So it's a consumer-facing service. Now, it's manifested in an app. There is an app that you can use, has your records, has all the Mayo knowledge, has all the HIPAA secure messaging in it. But really, the key is this service. So 24 hours a day, real time, you not only have access to somebody that can help you with that rash or that bump or that broken...
There's humans on the other end.
Humans that can do anything with healthcare. There is no. The answer is always yes, we're going to solve that for you. There's actually up to the barrier of the law about how, where the limitations are for delivering care. And what we found is that we can change the relationship people have with their healthcare. And that's why, literally the first hour of being live, we went live 60 days ago, we had paying customers.
Really?
Yeah, this is
subscription model?
Subscription model, monthly subscription model. And I think that was the proof.
Who pays?
Customer. Yeah, it's $50 a month. It covers your entire family. And so if you have 12 kids, it's $50 a month. If you have one kid, it's $50 a month. If you want to put your parents on, it's $50 a month. We want it to be simple. Healthcare is complex. Healthcare is about deductibles and all these. It's simple, $50 a month. And you can actually, there's all kinds of ways you can use your HSA or FSA to pay for it. But the whole point is it's simple, it's there, and it works for you. So if your insurance company's not working out for you, you're not going to call your insurance company. We're that trusted source to navigate all that. And when it comes to medical decisions, the Mayo Clinic is there behind you. While we work with other health systems, that Mayo Clinic, that's the safety net. 24 hours a day, they're available to you, $50 a month. So
Screaming deal.
yeah, I'd like to think so. I mean, it's really the best part. I think the proof point for us is there are real paying customers. We did not want to run a fantasy company. There was from day one this had to be a company that generates revenue, and that's what we're doing. It's really exciting. Yeah.
So what's next? Where are you guys taking this right now?
Yeah, well,
I mean, you got to get 200 million. That's the goal, right?
Yeah, right. Well, what's next is 200 million. But on the path to 200 million, there's obviously a lot of other technologies that we want to be integrating. We really want to push on getting more doctors and providers and people's kind of solutions, whatever their healthcare solutions is, pharmacies, data sharing. So there's a lot of relationships and BD work, obviously, within healthcare. But the single biggest thing is this is a novel thing. There's nothing in the healthcare system that actually works for you, right? It's always something for your doctor, something for your insurance company. There is no one that works for you, right? Your doctor doesn't work for you. Your doctor works for your insurance company. So actually, there's a lot of people who call us and they say, so wait, $50 and you do what I want? Like there's a lot of education that we have to do. There's a lot of folks for it. So I think really getting the messaging out there, getting people to understand what we do, getting people to understand how important this is and that it's accessible. Doesn't have to be expensive, doesn't have to be hard. It's simple. It's like your remote control. Pick it up, press the button, someone's helping you.
All right. Well, you pretty much crushed that one out of the park. So,
Very kind. Thank you.
You guys, like literally, you're sitting over there and people are mobbing you, so I want to get you back to the mob. Leslie was hogging you. She always does. But,
that's right.
Hi, Liz. But how do people reach out to you?
Yeah, so this is my passion. Digital health is my passion. Health Hero was a long run. Rock Health was great, and it's still work with them. And so if you're in Palo Alto, just come to the office. But if you're not in Palo Alto, Geoff, Geoff, at getbetter.com. You can find me on LinkedIn or stuff, or anywhere on getbetter.com. If you email us on that site, I'm going to see it, and I will find it. And entrepreneurs, whoever, just come. Even if it's just hang out in the office and be around other people who really care about this.
Awesome, true entrepreneur Geoff Clapp from Better. Cheers. Thanks for your time.
Thank you very much. Thanks.